Have you ever been to the hospital with a particular health complaint and your doctor begins to ask you some questions like, what's your name? How old are you? Where do you live? And all that. And you're like, I came here with a complaint of abdominal pain. Can we just get to the point and stop asking me these flimsy questions? Have you ever thought that way? So this video will be addressing the reason why we actually do not go straight to the complaint, but begin to ask you initial questions, what we call the biodata. Now, this biodata is very important, and this video will be giving you reasons. One thing you should know is that this biodata is kind of specific for every patient. In no order. One of the questions you'll be asked is your name. Yes, your name is very important. Of course, your name is your identity. And your name differentiates your folder, differentiates you from the next patient. Where I work, we have over 500 people coming to the hospital. And one way we differentiate them is using the name. So when your doctor asks you your name, please tell him your correct name. Of course, Ben Jack is totally different from Ben Yellow. So your name is your identity. The next question your doctor will want to ask is your age. And you're like, why are you asking my age? In your mind. We usually ask for your age for some reason, but I'll explain one of them. The main reason we ask for your age is not to necessarily know how old you are for just the knowing sake. No, but there are some disease conditions that you find in some certain aged group. So you can have an elderly woman, let's say someone from 65 years and above, coming down with knee pain in the knee, and I see a 20-something-year-old coming down with pain in the knee, I will be thinking of different things. That is why your doctor wants to know your age, because there are disease conditions that are peculiar to some certain age group. The doctor will also want to know your sex. Of course, as you walk in, he or she will know that you are female or male. Next is occupation. The doctor wants to find out, are you employed or not? This can determine to what extent you can foot your bills. If you're working, are you self-employed or you're working for somebody or an organization? You also want to know what kind of job specifically do you do. What you do for a living can affect your health. Someone who produces cement can come down with respiratory problems. Someone who uses firewood to fry akara, bole, yam to sell can also come down with respiratory problem. Someone who is a work from home, let's say a work from home mom, always on the computer, can have issues with her eyes. These are what we call occupational hazards, diseases that are linked to your kind of job. You can also have caterers who eat a lot of cabbage. Cabbage has been found to be associated with goiter. So when we ask for your occupation, these are the reasons. We also want to know your marital status. Are you single? Are you married? We want to know, because how we will manage a single person somehow is different from a married person. Even when you're married, we want to know how many children you have, because a married woman who has fibroid, symptomatic fibroid that is disturbing her, maybe she's bleeding so much, it's causing so much pain, it's so massive, looking like she's pregnant, and a single person with fibroid, managing those cases are not the same. For a single person, the doctor is more worried about preserving her womb, her womb, so that she can achieve pregnancy when she gets married. But for a married woman who probably has even completed her family size, she doesn't want to have children anymore, the management is different. That is why we usually ask what your marital status is. Next thing we want to find out is your address. There are several reasons for your address, but I'll be addressing one of the reasons. There are some people who live in a particular area and they are prone to coming down with diseases. People who live in high mountainous areas are prone to coming down with thyroid diseases. People who live around the riverside, most times they can come down with diseases associated with poor hygiene, poor drinking water, and poor sanitation. The next thing your doctor wants to know is your religion. That's a Christian, are you a Muslim? If you're a Christian, are you Pentecostal? Are you Catholic? Are you a Jehovah's Witness, Adventist? Because there are some peculiarities to some of these denominations. For example, a Jehovah's Witness will not take blood. And so you have to take note of this when you're managing this patient. The Adventist church, they do not eat snails, they do not eat scaleless animals. And some of these animals, scaleless animals, provide some certain nutrients in the body. Some other religion, they walk barefooted, exposing them to coming down with some disease conditions like hookworm infestations. So here are the reasons why we want to know your religion. And finally, tribe. Some certain tribes, if a part of the body is removed and that person dies, such a person will not be buried. He or she will be taken to the evil forest. So there are some peculiarities with tribes. People from such tribes will rather die than cut off a part of their body that is a problem. Let's say somebody with breast cancer detected early. One good way of managing such patients is to cut off the breast. But such people will refuse because of their tribe, where they are coming from. Perhaps it is a taboo. So these are basic reasons why your doctor will ask you this biodata. This video is something you liked. Please hit the like button, subscribe to my YouTube channel, and share so that you can help others. Until I see you again, keep winning.